chapter stands out with its remarkable contributions, fundraisers, series of webinars, and weekly bulletins, and helping the local communities in Alberta and in Pakistan. I was pleased to know that food was distributed to the Calgary Food Bank and aid was sent to Pakistan.
I congratulate the chapter on its robust participation in APPNA's COVID response, and will also like to acknowledge various chapter members who have actively served in various alumni association and central APPNA committees. I want to acknowledge the Alberta host team led by Dr. Tariq Awan, but also includes Dr. Ishfaq Shoaib, Dr. Hussain Bawa, Dr. Saad Yassin, Dr. Samina Bajwa, Dr. Amir Aslam, and Dr. Kishore Jamal.
We are delighted to host our second Healthcare Day today in association with School of Public Health, University of Alberta.
We've all shared in the collective effort of struggling with the reality of the pandemic. And despite all the personal experiences, protocols, strategies, and life hacks we've all amassed, questions still persist.
We are heading into what Joe Biden had called the dark winter, and it does scare me that we have some tough months ahead of us.
There's misinformation about absolutely everything out there in relation to COVID. It's been called the infodemic, right? So let's talk about some of the misinformation that's out there. There's those big things. You guys know this. There's misinformation about where it started. There's this idea that it was created by 5G technology. I don't know if you guys have heard that, but it's extremely popular myth. The idea that it's a bioweapon that has come out of China. There's even a myth that it came from a comet, that has actually become a relatively recent one. And then all the other conspiracy theories, the idea that big pharma is associated with it, for example, all getting a lot of traction. In fact, I'm almost certain that COVID-19 came from the grassy knoll. You heard that from me. This is data from the UK that found about a fifth of them believe that COVID's an out-and-out hoax, that it's not even a real thing. Data from the US, you find numbers like this. In fact, this was relatively recent, and since this Pew survey was done, the numbers have even increased. But 3 in 10, or 4 in 10, depending what survey you look at, believe that it's a bioweapon. This is one of my favorite examples because it's so absurd, it's so crazy. This was a poll that was done in the United States, and it found that only 1 in 4 Republicans disbelieve the Bill Gates conspiracy theory. And the reason I love this one is that's a hardcore conspiracy theory. This is the belief that Bill Gates started the pandemic in order to vaccinate the world so he could put a microchip in all of us and monitor our movements. It's really absurd. What about Canada? Well, the numbers here are pretty grim. This was a survey done by colleagues of mine at Carleton University, and they found about half Canadians believe one of these big conspiracy theories. This is just one example from that survey. We've got 26% of Canadians believe in the bioweapon conspiracy theory. We've got to debunk this stuff. We partnered with this entity, Media Smarts. They're a media literacy organization, to really encourage Canadians to check, then share. Check first, share after, and we can all make a difference. We can make a difference with your patients, with your public, and really with all Canadians.
Professor Caulfield talked about an infodemic, and I'm here talking about potential twindemic. This year will be more than ever crucial in getting vaccinated for the flu to reduce that risk of overwhelming the healthcare system, and the presence of underlying comorbid conditions really increases that risk of death from influenza. Everyone's talking about the COVID vaccine, but we have an effective vaccine for influenza, so get vaccinated. And remember, those who are at higher risk of flu are also high risk of COVID. So people with chronic conditions, those under the age of 5, those over the age of 65, follow public health guidelines as recommended. Remember the 3 C's of prevention: avoid closed spaces, crowded places, avoid close contact, stay connected, and stay safe.
38% of Canadians feel as if their mental health is declining, and about 46% of them are starting to feel a little bit more anxious. Now, the anxiety piece is very important because, as our previous speaker identified, is that they can actually delay us in going into hospitals and getting care for physical conditions as well. For instance, if you're having a heart problem or a problem related to your appendix, people are quite worryful and scared that they might catch the pandemic if they even go to the hospital in a situation of that nature. Well, a survey conducted by the Canadian Centre of Substance Use and Addiction showed that about a quarter of Canadians between the ages of 18 to 54 are consuming alcohol more than they were prior to the pandemic. Some advice in terms of how to maintain a degree of resiliency as this pandemic goes on, because it looks like it's going to go on for a little bit longer. The last message I want to leave with everybody is establishing balance in your life.
SARS-CoV-2, the virus that causes COVID-19, is about 10-fold more lethal than influenza. There's a wide dispersion of the spread, so a small number of people are responsible for a lot of the spread. Some of the modeling studies based on transmission have suggested that about 10% of people account for about 80% of new cases. This also makes it hard to control, because even if a lot of people do the right things, a few cases can spread very widely. Lockdown is a very blunt instrument, but that's why it's also highly effective. And so it's kind of the last-ditch effort. The cornerstone of control, if you can't actually eliminate, is to test and trace and isolate. Find cases early, quarantine them, find their contacts, get them to be quarantined before they can spread infection. So you're trying to basically create a ring around cases where there's not going to be outward spread anymore. That's challenging because it really depends on timing. I think that we have to keep adapting our evolving knowledge to be clear, to give the best possible advice to people about what they can do to reduce risk. I also think we have to be very steady in that we don't want to mislead individuals or don't get misled by individuals who are sure they're right, and to diagnose and treat where the transmission is happening. So our restrictions should target where the problem is. Ensure that people can take quarantine and sick days, that's financially possible for them. I think lockdowns remain in the back pocket as a backup plan to suppress the epidemic should it get truly out of hand. And that decision has to be earlier rather than later, given the nature of epidemic spread. And vaccines will be the goal and also the next challenge. But I'm actually thinking that if we can just maneuver our way through the fall and winter, that 2021 stands to be a much better year than 2020. It'll be a work in progress, though.
And I'm just going to change gears here and talk about how can we deliver services to maternity health services to poor pregnant women in some of the remotest parts of the world with fragile healthcare systems. The University of Alberta now works with the government of Pakistan to try to ensure that every woman giving birth in rural areas, but especially the poorest women living in some of the remotest rural areas in Punjab, receive safe, high-quality maternity care. The maternal mortality ratio, which is for the lay people here, a technical term that we use to measure the maternal deaths, has been gradually decreasing in Pakistan since 1990 and much more accelerated after 2000.
On behalf of APPNA Alberta membership, I'm thankful to APPNA Alberta Executive Committee, Program Committee, and School of Public Health and Hygiene, University of Alberta, for choosing such an important and relevant topic for today.